Hello, this is Pamela Josiah, and this week's topic is breast cancer. What is breast cancer? Basically, it's just cancer that forms in the cells of the breast, and most people have heard of breast cancer because usually they have a lot of awareness campaigns for this. It is also the most commonly diagnosed cancer in women, and it's not just in women too. It can also can occur in men. So here are some risk factors for breast cancer. Females are at higher risk. Also, genetics plays a part into it. Um, Family history does too. As for genetics, the BRCA1 and the BRCA2, if you have those genes, then you are at higher risk for breast cancer. Also, if you've gone through menopause and you're over 55 years old, then you're at higher risk for breast cancer. Also, if you haven't had any children or if you've waited a little bit to have children, breast cancer, also obesity, high dose of radiation to the chest, which relates to the second bullet point, previous cancers of the breast, uterus, or ovaries. So if you've had those previous cancers, then you've probably had radiation at some point for treatment. So how do you detect and screen for breast cancer? They start doing mammograms around 45 years old to 54 years old, and they want you to do that every year. Once you get to 55 years old, then you can do it every 2 years. Um, so, and you at home, you can also do breast self-exams, which are BSEs. The best time to do this is in the shower because you're going to be naked, and the heat of the shower can bring out some of the stuff that you want to find also. And if you're postmenopausal, then you're encouraged to do breast self-exams as well because you're at higher risk for breast cancer. So how do you perform it? You want to start with holding your arm up high, and you just want to start from the nipple out and kind of going in a circular motion. And you want to do these steps like on one breast and then move to the other breast so you can detect differences between each breast. So you can, so once you do the circle one, you can do up and down and also inward to outward, and that can help you detect for lumps. You want to stand in front of the mirror as well and just look at your breast. Look for any lumps or abnormalities in the skin. Look for some asymmetry that wasn't there before. You want to also hold up your arm and put your hand behind your head, and that'll make it easier to see some differences as well. And for the next step, you want to put your hands on your hips and just look at your breast and see if there's any changes. And afterwards, you want to lay on your bed, put up your hand over your head and palpate your breast again. So as a nurse, what are we going to do if we're assessing a patient? And these are some clues that could give us for a person that has breast cancer. If you palpate a mass in the breast during an exam, also you want to look for asymmetry. If you're looking at their breast and there's like discharge from the nipple and it's bloody or clear, you want to look at the nipple as well again and look for retractions, or if it's elevated, there might also be skin dimpling, retraction, or ulceration. Their breast might have skin edema or peau d'orange. I don't know how to pronounce that, but basically what that is if you're looking at their breast and it kind of resembles the peel of an orange, that's a sign of breast cancer. They might also have axillary lymphadenopathy and lymphedema of the affected arm. So what are treatments for this? This is usually a combination treatment of all these four things: radiation, chemotherapy, surgery, and hormone therapy. For surgery, there's 3 different kinds. You have lumpectomy, which they just remove the tumor, but they leave the breast tissue and the nipple. but maybe they remove the lymph nodes. A simple mastectomy, they just take the breast tissue and and the nipple out, but they leave the lymph nodes alone. And the modified radical mastectomy, they remove everything but leave the muscles. So, nursing interventions for after they have a mastectomy. So post-op, you want to monitor their vital signs, check their temperature for signs of infection and other complications that could occur after surgery. As for positioning, you want to put them in semi-Fowlers, turn them on their unaffected side, so keep them off that side that they had surgery on, and you want to keep that affected arm elevated, so you want to promote drainage of the lymph nodes so they don't get edema of that arm. Also, you want to encourage deep breathing exercises so they don't get anything like pneumonia or atelectasis. They might have a drain placed to help with the drainage of the excess stuff. Usually they have a JP Pratt, so you just want to maintain the patency of that drain and make sure it's in place. Make sure the suction's in place, so make sure it's still squeezed and closed, and you want to make sure you're documenting the output of that drainage and you're looking at what color it is and the characteristics. You want to assess for signs and symptoms of infection, and if they have severe lymphedema in that arm, they'll probably have you administer diuretics, and that patient should be on a low sodium diet. So patient teaching after a mastectomy, it's kind of based around just taking care of that affected side. So you don't want to overuse that affected arm. Make sure it's like resting and you're using the other arm more than that one for the first few months, and you want to keep it up elevated just to keep that drainage going. You want to encourage continued breast self-exams on the remaining breast, as they still have a chance of getting breast cancer on that side. You want to make sure that they're avoiding strong sunlight on that affected arm. They shouldn't be carrying heavy pocketbooks, or that should say purses instead of dresses, on that affected arm. They shouldn't be wearing clothes that are too tight or constricting. If they're gardening, you want to make sure they're wearing gloves, and if they're cooking, they should be wearing oven mitts. They can put hand cream on that side of the arm, and instead of like cutting their nails or clipping off their cuticles, there's cuticle cream remover. Also, you should stress this, I put it in bold because it's very important. In the future, they shouldn't have any blood pressures, IVs placed, or injections or venipunctured on that arm that they've had that mastectomy, because the lymph nodes are already damaged, so they can't drain as well, and sometimes you can blow blood vessels. And that's pretty much it.